She is a Spitfire. She was a Spitfire. That was so fun. I love that she's taking something that already existed,
Yeah.
and made it her own and specified it for nurses. And I love the arc that comes from the podcast. Like, I got to think of another version of that question because it's getting old for me. But I always find that it's something profoundly changed for them, an awakening, a health crisis, a family crisis, a career crisis, whatever. It was like that soul boil went.
Yeah.
And they served, not only did they survive, but they thrived. And then how did your life change? So it totally cute. And then she didn't stop there. It's the people that we always are interviewing is like, they wanted to take what worked for them, what changed their life, and give it away. How do I'm busting at the seams to tell other people about this. And, and I love that perfect arc. And now it's like Modern Nurse Fest, Somatic Nursing, da 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 da. And then it's so creative. It's like transformational creation.
Yes.
Yeah.
And it's so necessary today. That's what, when we were talking about it, it's like, it's not people with just diagnosed mental health conditions. It's applicable to everybody today. It's every nurse, it's every patient, it's every non-patient. It's such a necessary information to get out there. I think it's incredible.
Yeah. And the nervous system is so complex and it's so all encompassing of every mental, emotional, physical, everything. That I love conversations like this because what's considered almost too nebulous to help, that is targeted treatment or targeted therapy on the nervous system because it's all over the place. So it sounds nebulous, but you mitigate that chronic stress response in whatever way you do it. And what I love about this diabetical behavior therapy is what she said about how it can be used with patients. Like, you get these 4 things down, you recognize which of the 4 areas, the mindfulness, the emotional intelligence, the interpersonal effectiveness, the crisis intervention, where is this patient at? And then automatically what intervention to use. If it's number 4, you dunk their hand, give them an ice bath. Yeah. It's, if it's number 1, it's like, let's just what can you do to bring them here now? Not in the future where something might go wrong in the OR, not in the past, of the accident that you were in that got you into the OR, right here now. Every level, there's multiple techniques that you could do to really not only help the person feel better mentally and emotionally, but actually reduce their oxidative stress and inflammation right there and then. It's cool.
And it goes back to some of the conversations we've been having on other podcasts, because now as a nurse, when I can connect with my patient in that way, right? It was reminding me of Irma. Oh gosh, in the podcast we did with her. Now I'm connecting with the patient. I'm seeing them, right? And I'm coming into coherence with them. Right?
Yes. And it's good for you too. It's good for the nurse too. Yeah. Good point.
Exactly.
I love that point. Exactly. Especially because whatever's good for me. No, that's beautiful.
Good for the goose is good for the gander, right? Wasn't that a saying?
Right.
Is that how you say that?
Yeah. Everyone's going to love this one. Enjoy, everybody. Welcome to the RNegade Podcast, a revolutionary approach to continuing education for nurses who don't just do what they're told. We're shining a light on the pioneers, the innovators, the renegades who are blowing up the boxes that the rest of the world is still trying to think outside of. On our podcast today, we have Emily. Who is it, Wendy? Who do we have? Emily Knife. How can you forget that last name, Karen? Anyway, she's a mother of somatic nursing, as well as many other things that I learned a lot today, that of things dialectical behavior therapy and her background and the modern nurse fest and all these kinds of things that are so interesting. Not only things to learn, but things to get involved in. Everybody enjoy. And nurses who are listening to this podcast, don't forget, go to rnegade.pro or renegade.thinkific.com. Is that right, Wendy?
That's right.
And you can get continuing education credit for listening to this podcast. You go to the platform, you register. If you're not registered already, you take a little simple quiz and do a little evaluation. And there you go, just for listening to the podcast. RNegade, bringing you continuing education in line with what you're naturally inclined to do. Enjoy, Emily Knife. Who are you?
Yeah.
Why are you here?
Yeah.
Tell us about yourself.
So perfect. So, well, thank you for having me on this fabulous time together.
Pleasure.
I'm so
already.
excited to be here. Yeah. So excited to be here. Yeah, my name's Emily Knight. I've been a nurse for about 13 years now, and I got into nursing because nurses helped me, and I was like, nurses are amazing, and they always provided me so much hope when I was in hospital myself. So I was like, I want to be a nurse when I grow up. And I also had nurses in my life too that showed me how awesome nursing was as well. So let's see. So fast forward to this point because I made a vow last year that I no longer talk about the past, but we talk about the present and the future and like what can we become, right? Because if we keep talking about our trauma over and over, like it doesn't get better. We just stay in that trauma. So we're moving from that point and we're moving to the present. So
I love that.
Somatics came about. So I'm the founder mother of Somatic Nursing. And that all came about because myself went through lots of mental health treatment. And I was just kind of always stuck at the same place. It was just like always very cyclical. I was like not getting any better. I was like, why do I have to keep talking about the same thing over and over? And, you know, in mental health, we switch providers quite a bit. And so every single therapist or provider you go to, you have to say the same thing over and over. And so I was tired of doing that. And I was seeing other people go through that as well when I became a psych nurse. I'm like, okay, well, I've seen the patient side. Now I've seen the psych nurse side, and neither of it's any better. Like we need to create some change. And so, somatic
you just
nursing
took
came
it upon
about.
yourself.
Yeah, I was like, this is not okay anymore. Like somebody has to create change. And I know there's like so many change makers and things like that, but you know, not really so much in the nursing world. Mental health in the nursing world is kind of like the field that you don't want to go into. And that kind of stems from nursing school, how we get taken to these places that are like horrendous, and we're like, there's no hope for mental health. It's like, yeah, well, no shit. Like, you're going to places that people are like climbing in the rafters and calling themselves Spider-Man.
Yeah, it's like the
really
Australia of nursing. Just send all the criminals there.
yes. Yeah. So, yeah. So all of that, like the journey and everything, um, you know, kind of found myself stopped seeking external validation and advice from others and just finally started just asking myself, like, what do I want to do in this world? You know, like, what's my mission here? So that's how the School of Modern Nursing came about. That's how Modern Nurse Vets came about, is all from like meditation and going within. And so, and quieting, like instead of coming from a place of like fight or flight, I came from a place of like just connectiveness, you know. So
Plugged into the main. So is that where you got all your ideas?
yeah, either in the shower or either like in deep meditative states. Yeah.
I find when I blow dry my hair, I think it's because that noise. Like, how about you, Wendy? Where do you get your best ideas? Oh, walking your dog.
Hiking. Yeah. When I'm out hiking with the dog, I inevitably come home and call Karen and go, all right, here's what we need to do.
Yes.
Yeah. And Emily, it's so crazy. Sometimes like neither one of us can sleep. And when it's like just almost polite enough to text her that early, I'll be like, and it's like the exact same thing she came up with. We've had so many of those, but that is just to validate your meditative downloads. Yes. That's where all the good stuff comes from.
Yeah.
So you just saw it like Mozart sees a symphony. You just saw like the School for Modern Nursing.
Yeah.
Everything laid out before you.
Yeah. And it's funny. I had this question yesterday when I was on another podcast, and she was like, was the vision clear? And it was like, I don't really think, I mean, like our visions are obviously like visions of how we want to see it, but like it's not, it doesn't ever really quite go that way.
Sure.
You know, and so from that vision really became more expansive when I started collaborating with other nurses that are like, hey, like, let's take this another step higher. And I was like, yes, let's go. You know, so Yeah, the vision wasn't, it wasn't quite like I saw it. It's like way better.
Well,
Than
just to set the stage a little more, because I love where you're going with this. What
yeah.
was it about you? Because a lot of people get great ideas in the shower or in meditation or on a hike or when they're blow drying their hair, but not everybody follows through with it. Like then the ego comes in. You're out of the meditative state. You're, the doubts, the insecurities, the like, who do I think I am to do this?
Mhm.
What was it? What was the bridge between the idea and action?
Yeah.
Was it
Yeah.
something that you had been through before? One of the versions I always like to, there's a version of a question I always like to ask people, because people that we invite on our podcast are change makers and pioneers and innovators and renegades. And the version of the question I like to ask is, tell me about something that happened to you that made everything different from one day to the next. And the reason that's not a loaded question, because I find that their version of that answer is what's behind their passion that got them over the fear, that got them over the why me, who do I think I am thing. And it doesn't have to have anything to do with the chronology of your story. But what is it that made you that made you take action instead of just like, oh, that's a fun idea.
Yeah.
Too bad there's no one around to implement it.
Yeah, right. Like, yeah, how can I give this one away? Sell it for $1 million. Yeah, so I'm big in the mental health realm, and to be very blunt and honest, I have been close to death way too many times from my own discord and put myself in situations where I'm like, I just don't want to be here anymore. So being that close to death, like all I want to do is live now and do like really epic shit, which is right behind me. And so
I love that.
that was like, I'm still fearful. Like,
Sure.
don't get me wrong. Like, I'm still like, holy shit, what am I doing? But that's like the joy in it. Like that's where like the messiness of like failing and like succeeding like becomes ultimately like why we're here, and like why we hang out with cool people, and like why we get to just live life, like for so long I didn't want to live life. And so now I'm like, what cool shit can I do? Like I'm almost close to getting approved for skydiving solo, right? So it's like, where can I find the adrenaline rushes? And that's like doing fearful shit. you know?
Yeah. Oh my God, that's so awesome. That's so beautiful.
Yeah.
And that's I feel like we're leading our way into the whole somatic conversation, because when you live in fear, right? And we turn on that part of our sympathetic system, and our body's in the negative aspects of stress, it's hard for that intuition to come in, right? It's hard to meditate. It's hard to hear, whatever you want to call it. Karen calls it George. Whether you call it grace, whether you call it God, whether you call it Christ consciousness, whatever, that is really hard to hear when we're in this complete state of negativity and stress and fear, a fear that's debilitating in a negative way. Like, so how did you then figure out what was fear that was keeping me locked in a negative state of self versus transitioning into that exciting, listen to this, throw myself in? That's a completely different experience.
Yeah.
How'd you get yourself there?
Yeah, that's a great question. Yeah, I got myself there with like kind of just asking like, why am I this way? Like, is this the way I'm supposed, like, because I got asked one day, like, why are you so happy? And I'm like, is it not normal to be happy? And this was like a grown ass adult being like, why are you so happy all the time, Emily? And I'm like, why can't I be happy all the time? Like, is there a requirement of level of happiness like that I'm supposed to exude throughout the day? So that was kind of a turning point of like in society, like we're so often portrayed as like we have to be broken to be normal. And it's like really, it was like such a bizarre thought to me and visual of so many people I know that step more into like a depressive state because that's what they choose, because it's actually harder to be happy. You have to put like some effort into it, you know? So I think it was diagnosing myself with borderline personality disorder and then going and getting like approved by a psychologist that was like, yeah, you for sure have this. Like, we should get you some help. And I'm like, sweet, let's go. Like, thank the Lord. Like, I finally have an action plan of like why I'm not crazy. Like, this is just who I am. I just need some skills like to
Yeah.
help navigate these situations. And so yeah, it was a turning point. It was like literally after I had my kids, I was in my master's degree program, and I just got like to a point where I really didn't want to be here anymore. And like my nervous system was just so overwhelmed that I had several attempts, and that was really the turning point. Like, I think I'm in control of myself. I just don't know how to get there, but I need help getting in control of myself. And I know that I need to and I can be in control of my thoughts, my actions, and all of that. So
Yeah.
yeah, it was under extreme duress that I was like, I need help. And like, how can I? Yeah. And then ever since then, I don't have suicidal ideations anymore. I'm not really in a state of like, when I do get depressed, I'm like, okay, what's going on? Like, is this even justified to be sad about this? Or are you just going back to old cycles because that's how you used to handle situations, So,
Absolutely.
um,
Yeah,
yeah.
or we've been taught that, we know we don't even have to be taught. You cut your finger and it heals. You don't have to go heal and encourage it. And actually you get in the way if you start trying to help. Um, Same thing with digesting our food. We don't like squeeze our stomachs and like, but all that
Right.
stuff, our heartbeats, we breathe, we wake up, we go to sleep, whatever. And when we're sad, for some reason, or like even severely sad, like facing a soul boil, I call that a soul boil. Like there's something
Yeah.
in there festering, and when it's ready to go, it's going to either kill you by your own hand or somebody else's, or illness or something like that, or it's such a dramatic that it's ripe for tremendous transformation.
Yes.
But I think our minds, not I think, I know our minds are designed to heal on their own.
Yeah.
The cliche
Yeah.
snow globe metaphor, you shake it
Yeah.
up, and then we're trained as human beings to not be sad, to not be angry. That's not okay. So what do? We get afraid and we like try to tilt the snow globe to get it to settle faster. Like,
Yeah.
heal.
Right.
But I had suicidal ideation from like the age of 11 to the age of 37. I know the day it started, I know the day it ended.
Yeah.
And that's so my personal experience was just, I mean, even what saved my life was was another untruth that I found, that I would go to hell, that I would bring shame upon my family for the rest of my life. I mean, those were good lies to believe when you're battling that stuff. So
Yeah.
so what happened next?
Yeah.
So you saw that you weren't getting any help from going to therapist after therapist. You decided to kind of take the bull by the horns yourself, and you found something that worked.
Yeah. Yeah. And
What was that?
yeah. And it was from a similar situation. So it was dialectical behavior therapy. And
Wait, can you say that again slow?
I actually wrote a book. So
Even
it's
better.
it's it's dialectical behavior therapy,
Okay.
and it's literally should be taught, and like kids should learn this. I mean, they literally, it's like crisis intervention, how to not have those, have those thoughts, but negate those thoughts because they're not the truth, right? It's mindfulness. And it's interesting. Marsha Linehan is who created DBT, and she created DBT because she wasn't getting the help she needed. She was
Yeah.
basically like, fuck the system. I'm going and figuring it out myself. And she found out like the nervous system is really like the main point of, either response or repair or repulsion or all these kind of R words that when we're confronted with either internal or external circumstances that our nervous system reacts. So if we know how to like hijack our nervous system, then you literally you can become a superhuman. You literally can. You know, like everything you believe about yourself will become true. And you know, I was chronically depressed. Like I hate throwing that. Like nobody should be depressed for 20 years. And as a nurse, you know, we hand out depressive medication like it's candy, you know, and it's like that shit doesn't even, it's a placebo. There's no research evidence that that stuff even works. You know, it's like really kind of funny, but you
No,
know,
in
our
fact,
mind.
there's more research. It's making you worse.
Yes, yes,
Yeah.
yes. Yeah, it's like I have to take something, but I might possibly end my own life in 4 to 6 weeks. What kind of hoop day, right? Like, so
Yeah.
um, yeah, I mean, so DBT helped me. You know, I was in the Air Force for 4 years, and after I got out, the transition was really hard. I was put on like 8 medications, psychiatric medications,
Wow.
and I became a zombie. I stopped going to Ohio State. I was supposed to attend Ohio State University.
Go Bucks.
Yeah, go Bucks. I dropped out, and somebody was like, you should try marijuana. And I was like, yeah, maybe I should because I literally just want to die right now because of all the medications.
Yeah.
You know, and I didn't really have any purpose. It's almost like that transition nurses have too, like from student to bedside or from bedside to retirement or really from, you know, bedside to entrepreneurship. It's a very odd transition. And if we don't have the skills to manage our, you know, emotional complexities, then we can kind of go down some of these rabbit holes. So yeah, yeah, Marsha Lanahan literally saved my life. I did 2.5 years of outpatient therapy, for it was 6 hours every week for 2.5 years. And it was like the best investment of self ever. Saved my life, literally.
Oh.
Well, it
So
seems silly to change directions now because I've never
yeah.
heard of dialectical behavior therapy. Have you, Wendy?
I think so. I'd like you to explain it because I think so.
Yeah, give us like the what it's like personally and then like the mechanism of action and any research behind it if you know like what is
Yeah.
it? It's obviously working on the nervous system, but how?
Yeah, yeah. So there's 4 components. So you have the first one is mindfulness.
Mm-hmm.
And that's just becoming aware, right, of your own body, your own breath, your own thoughts. So it's literal coming down to an awareness of self. The next one is an emotional intelligence. So learning what emotions look like in your body, learning what emotions look like in other people's bodies, and coming down to the point where you're like, I feel sad right now because you called me a poopy head, right? Like that would be an example of how you verbalize how you're feeling, right? Instead of being like, I'm stomping off right now because I can't even name my emotion right now because I'm so out of sorts that I can't even become aware of myself, right? So it's the awareness of self, the emotional intelligence, interpersonal effectiveness is how we talk to ourselves, our inner dialogue, but are also our outer dialogue, right? So if I'm really fired up about something and I'm upset with somebody, it's because I am not either getting my needs met or they're not hearing me the way I want them to hear me. So I need to adjust how I communicate, right? So interpersonal effectiveness is learning how to express with communication how and what you need, what you feel, and how what you want from
Mm-hmm.
somebody without coming aggressively forward or anything like that. And
Mm-hmm.
then the last one is crisis intervention, and that's really the most important one. And you know, it's skills like tip, which is like temperature change. So maybe putting your face in a bowl of ice water, running your hands under ice water, and that's great for nurses.
Mm-hmm.
Like if they just did a code and they're in like shock mode, go in
Yeah.
the bathroom and just like feel the water on your hands and be in the present moment. Intense exercise. So it's literally bringing you to the present moment. That's what we do in crisis intervention, right? Because your thoughts, you're either in the future or in the past. So we're bringing you to the present moment. So that's
Okay.
the 4 presets of dialectical behavior therapy. And it's a very intense process to be trained in that for therapists. And ultimately, it's mostly used for the diagnosis of borderline personality disorder, but it really should be used in all, like, everybody.
PTSD. Yeah. Yeah, totally.
Yeah.
I love,
Oh.
so I love how, I mean, the whole overarching thing is present moment.
Absolutely.
Mindfulness, the whole point is to get you here now in a calm state, right? 1, 2 was, what did you call it? What was number 2?
Yeah. So it's like emotional regulation.
Oh, I have EI, emotional intelligence. Okay.
Yeah, intelligence. Yeah.
I love how that also brings you to the present moment because it makes you the witness.
Mm-hmm.
So you might be going batshit crazy, but it's like, what does this look like in myself? What does it look like in others? And so it forces you to be the witness. And the only way to do that is to get in the present moment. Number 3, love this one, interpersonal effectiveness. I interpret that as the good news is it's all your fault, because you mentioned
it's all your shit.
That is, well, that's the good news, because if it's somebody else, then you can't control anything. But it
puts
like,
the responsibility
what did you say?
back on you and the ownership.
Yeah. And when you said, I'm not being heard correctly, so it's on me to say it differently, when how many of us, this just happened to me, where I was mad at the other person for not listening, but then there's nothing I can do about it, because I can't get in that person's head and pull on their ears, metaphorically or literally. So I love that. And it gets you in the present moment, because once again, you have to witness and evaluate what's going on here. Yeah. And if you're all up in your head, you can't do that. And then the crisis intervention sounds like, what is the primary
tool?
Motivator, inspirer, tool, I don't know, device to get in the present moment. And the biology is the vagus nerve. Cold water, going for a run, horse lips. Love that one.
Breathing techniques.
Yeah. And so it's just 4 keys that open the same door to the present moment. Love that.
And all of that, literally all of that, then reframes your nervous system, because you're literally transitioning the feedback loop, right? For how you've always handled things in the past. Yeah. Now you completely change the feedback loop and have a chance at changing it for yourself for the future. You put a whole new spin on it, which then, number 1, changes behavior, but even your overall physiology in your body.
Yeah. The dirty little secret is it's actually really good for you.
Yeah.
It reduces oxidative stress and inflammation. And okay, love it, Emily. I'm going to stop talking now and let you go more.
I mean, you're literally biohack. I mean, I love biohacking. I'm a big biohacker. And you're literally biohacking your body, like, to the point, if I look at pictures 10 years ago, I do not look like the same person. And I think trauma shows up on your body. Obviously, it shows up in our facial features. It shows up on our body, and it's, once we start reprogramming our neural pathways, our neuroplasticity, things look different. Our bodies are then working at the ultimate state that it can work, because most people are just walking around like at 30%, like they're not living 100%. They're just like, I'm like, what's my favorite question to ask you, I'm like, what is exciting in your life that's happening right now? And they're just like, nah. I'm like, what like, you're breathing, but they haven't been where I've been, so I can't expect them to be like, oh my God, Emily, my life is so dope right now. Like, I can't expect them to be at the level of passion I am, because they obviously haven't been at the level of the cliff looking down, like, oh, maybe I should. I don't know, Well, so,
and if their sympathetic, because nervous system's been abused for a long time, which has happened to a lot of us, then your dopamine is going to be, levels are going to be in the toilet, because you're revving, you got the gas pedal to the metal with the parking brake on. So it wears down your sympathetic and your parasympathetic neurotransmitters. And if you don't have a lot of dopamine, if your dopamine's low, you can't experience those emotions, or at least not as aptly as somebody who's kind of, a flatlander. But it's the people like us that are like this, when you do this for so long and you wear down your adrenals and you don't have the dopamine, anhedonia. So what do you say to people like that, who, like, how do you tell them, in my personal experience, when you become the witness of your behavior, even if you're continuing the same behavior, I'm getting mad at this person because he's not listening to me. He's not hearing correctly, but you're watching it. Even if you're doing the same thing, it interrupts the neural pathway. It's like a little sideways, it goes like a little bypass to the sidewalk.
Yeah,
You've been
detour.
running for the same 20 years, it's like boop.
Yeah.
So I love that. What do you say to the people who aren't patient? Why isn't this working? I don't know. I can't feel pleasure. Nothing I used to love to do I love to do anymore? What do you say to people like that?
Yeah. I coach a lot of those people. And I've totally been in that situation where I'm just like, I don't feel joy. I don't feel pleasure. Nothing feels good. And it's absolutely practice. Some days it's going to feel great. Some days it's going to feel like ultimate hell because you're trying to ride a bike that you've always ridden two-wheeled bikes, and now all of a sudden you're riding a unicycle. So your body's going to be like, what's happening, right? So it's going to take time to adjust, like to do this ultimate feat, this ultimate skill of riding a unicycle is just like learning French. It's just like learning any IV insertion, right? It's like ultimately just practice over and over. And in those moments where you might feel like nothing's working, that's when it is actually working. When you feel and have that question, like nothing is working, like that shit is working. That's
Say
why
more
you're
about
having
that.
question. Yeah.
That's an interesting way to put it.
So if you're a nurse, what's the feeling you associate with going to the mailbox and seeing that notification that says your license is up for renewal in 90 days? Do you go, yes? Or, oh, right? Why? I mean, it's not like they're hard to get. You have 2 years and there's so much free stuff out there. And yet we drag ourselves across the finish line, kicking and screaming because they suck. They're boring and antiquated and the delivery mechanism is inconvenient. And the thing is, if you're a nurse, we love to learn. We're always listening to podcasts and audiobooks and YouTube videos because we're just curious. But we have to pick through this pile of crap so that we can remain a nurse. Well, we created RNegade.pro to change that. We wanted nurses to be able to get credit for the stuff that they're naturally inclined to do anyway. It starts with a podcast. And then we're creating courses, and we want everything we do to feel like what you're naturally doing. The research shows that that's how we learn and retain best. Check it out. Pick one. See what you think. So maybe when you go to the mailbox next time and get that notification, you'll have that, yes.
Yeah, anytime we question, like, is this a good decision? Like your body and mind already know that it has already made the decision. You're just trying to find more knowledge and information from your internal, external circumstance to clarify that decision, right? So anytime we have a question that's like, why am I doing this? You should probably dive more into like, why are you doing that? Or why do you need to do something?
Right.
So yeah, the moment that it's like, it's not working, like shit is working behind the scenes. You just ultimately cannot see it in your 3D. It is probably happening in the 5D because that's why you're having that question. That's why you're having that insight from like Gus, wherever, George.
I might be totally full of shit when I say this, but when you just said that, I love that you said, well, it's almost like analysis does not happen when you're really depressed and sad and suicidal feeling or insomnia, like any of the mood disorders, anxiety, depression, whatever, any kind of high stress, excitotoxic kind of mood or emotion does not allow for analysis. So if you're going, why isn't this working? When will this work? You're analyzing what you've been doing. That's analysis. So the mere fact that you're questioning why isn't this working or when is this going to work kind of shows that you're improving. Is that full of shit or does that make sense?
Yeah, no, that's totally what it is.
Yeah.
Okay, cool.
Yeah, because you can't see it when you can't see it, right? You wouldn't even be able to ask yourself the question to analyze if you're just completely operating from subconscious, unconscious behavior.
Yeah. You have to be witnessing yourself, which means you're in the present moment to be able to say, she's still batshit crazy. This isn't working. Speaking of yourself in the third person.
Right.
Yeah, I love
Yes.
that.
Yeah.
Totally.
Yeah.
All right. So we've been really, so you've kind of given us your story. We've been kind of nebulously talking about, I keep saying diabetic. Oh, it is diabetical. I was
Yeah.
thinking diabolical.
Yeah.
Diabetical behavior therapy. So let's bring the nebulous down to the concrete. How did this, give us a couple examples of how your life changed? You said you already said, like, even my appearance changed and whatever. Give us a couple examples of how life looked different from before and after for Emily. And then what made you decide to bring this, like, to make it your mission to bring this to nurses and other people in general? I mean, it seems like your main focus is on the nurses and the nursing profession, but is it just like anyone? I'll stop. How did your life look different? And then what made you take it to other people?
Yeah. Yeah. So I'm going to answer that kind of backwards here. So,
In any way you
know,
like.
I have this gift of dyslexia. People say it's not, but I'm pretty sure it is. But yeah, it's
The gift.
we just see things differently. Like we can solve shit, like it's really a gift. So yeah, the reason why I brought this to nurses, first of all, was because we have such a problem with, like, we don't have enough therapists. I mean, there's a mental health crisis right now. We know this. We've seen it happening. There's also a nursing shortage. All these things are happening. So I looked at it and I was like, well, if I get nurses spun up on like how to teach this to people, then if we have somebody that's about to get open heart surgery and they're having a huge anxiety attack, but the nurse knows these situations and skills, then they can print out a form or whatever and give it to the patient and be like, hey, it sounds like you're experiencing anxiety right now, and this might be in relation to your current procedure that you're about to have. Would you like to talk more about maybe some fears or, what you're feeling right now, right? And holy crap, like sometimes we don't have time for that as nurses, but it's like ultimately going to save that person from possibly being readmitted into the ER because they're not having a heart attack, they're probably having a panic attack, right? So it's like this cool underline of every nurse should be trained in mental health because every patient is a mental health patient. Like
Totally.
it doesn't it doesn't matter. Like if you're coming in for sickle cell, holy shit, you're having a crisis mentally, and a nervous system is having a crisis itself. So I wanted to bring ultimately nurses to be able to do more than just prescribe medication, because I dropped out of um, nurse practitioner school 3 times because every single class was such a focus on medication. And I'm like, it's not like we don't need more medication. We need to know how to regulate our nervous system. So, really kind of coming back, ultimately, the way that I've changed was I was, highs and lows, like extreme highs and lows. So say I got like a D on a paper in school, that would have been like my closest aunt died. I mean, it was like all like I just wanted to be left alone. I didn't want to be on this earth anymore just because I got a D on my algebra paper or whatever, right? So, experiencing these beautiful emotions, which I didn't see as beautiful at the time because they were hurting me, because I didn't know how or why they were happening, right? So seeking providers, all they wanted to do was drug me up, so I didn't feel anymore. When it was human to feel, and it's like so cool to feel, right? And so when I started going through DBT, I was like, wow, these emotions that I'm having, they're like gifts. Like some people don't get to feel this hard. Like that is so cool that I get to feel this hard, right? So switching my mindset to seeing something so detrimental to turning it into something that is like my superpower.
I
And
love that. There's a quote from an enlightened Scottish, well, he's Rip Sydney Banks. It was an enlightened Scottish welder, and his quote that I love is, if the only thing people learned was to not be afraid of their experience, that alone would change the world. And that you just summed it up right
so
there
beautiful.
paraphrased it in your own personal way. Go on, Wendy.
We're
What?
creating our experience because of how we're interpreting it in that moment. So, right? Like we're literally creating it and then creating the dis-ease that's happening in our bodies that then is a reflection of how we're feeling inside. So like when you're saying my whole body changed, of course it did, because you were in such dis-ease internally that the body becomes this reflection of it outside of it. When you get healthy inside, everything changes outside because your body's in a completely different state of being.
Yeah.
So
I'm sorry. My dad's dog is outside, and usually he's not outside, and I have to make sure he doesn't try to escape.
we'll let you be the
gosh.
watchdog.
I'm so sorry, but
It's okay.
He's recovering from hip surgery right now, so he can't go outside. So I might. No, he's all right. He's trapped. My version of that, Wendy, of creating your own experience, and Sydney Banks's quote is, "You're only ever having sex with yourself."
Yes.
Yeah.
I mean, like metaphorically speaking, yes, sometimes literally, but I mean, really, you're making up the like your lovers, your friends, like the thing that freaked me out the most was when I'm like, I understood, okay, my version of Wendy is different than her husband's version of her whatever. So Wendy doesn't even exist. I'm the only one who exists. But then I realized Wendy's version of me and Emily's version of me and my parents and my version of me changes from moment to moment. So I don't exist either.
Yes, it's like,
and it's all based on how we're just interpreting that moment. Like things.
It's such a mind fuck.
Yeah, totally.
That's good.
And so I told Karen I found you with your post about how toxic the hospitals were. I was like, right on, because we had just been doing some podcasts on like circadian biology and health, and right. So when I saw your post, I was like, oh yeah. So I wanted to tie that to, this isn't even what everybody's experiencing right now, doesn't even have to be tied to a labeled mental health condition, right? Because there's so much happening wrong with how we're living that it's creating the symptoms of mental health conditions. So nurses working all the shift work, being in all the unnatural light, eating terrible food, living in a world that only thinks to prescribe medications. I mean, I can go on and on and on. Like it's just, we're completely living out of balance with our natural state. And that in itself is creating conditions that feel like mental health conditions. So your program is literally applicable to everyone today. Like it's down to the schools, the kids too. Terrible food, terrible light, sitting in a chair, right? In the classroom, told what to do, can't move your body.
No wonder we're all wazzed out.
Yeah. I mean, it's literally the modern epidemic. I mean, if
it is.
This is actually the epidemic. It is a plandemic on some ways because it's how our system works. So you couldn't see it a better time for doing this, because educating nurses themselves teaches them how to live differently and in relationship with their patients.
But that leads me to another question. I'm glad you combined those two. So we got the background, very interesting. But you had anecdotal, experiential, personal, and with others, that what you were doing, this somatic process. I'm going to sound like an idiot for a second until you correct me. Is dialectical behavior therapy is that the gateway into somatic nursing? Like, are they two separate things? Is somatic nursing like an umbrella and that's one way to do it? Can you tell us a little bit about how those things are categorized and what's your methodology? I guess.
Yeah, yeah, absolutely. So, yeah, so somatic nursing, it encompasses the nervous system and just understanding that a lot of times the nervous system is the root cause of most all diseases and disorders in the body. This is just like one of the modalities that could be utilized in using somatics as a like healing modality for people, right?
Okay, so your
There's
definition
like,
of somatics is hacking the nervous system,
yeah,
basically,
yeah,
to reduce any emotional distress or downstream inflammation. I imagine it's got lots of benefits. Okay,
yeah,
thank
yeah,
you, Claro.
yeah, yeah. Um, yeah. So yeah, I mean, it's been like a life-changing journey, and microdosing has helped too. I mean, there's so many things that are kind of kept like hush hush, and I teach about, like psychedelic therapy and just understanding that, and nurses just haven't not participating in it so much, but like actually just being educated in it and not
Yeah,
looking and, looking down upon
familiarize.
people, yeah,
Yeah,
that
I would
have
love
it
to.
or
I would love to have another podcast about that. Although because it's still in the research phases.
yeah,
Unfortunately, it's been a long time coming, but because it's still in the research phases, except for the endocannabinoid system, we just did a podcast about that. So those are like really fun and interesting things to talk about. But because this is worth a continuing education credit, I would love for nurses to know a little bit more about the results of somatic nursing, which the term that you've coined. What other ways, like what other methodologies or techniques do you use? And then what are some of the results that you've seen? And if you can talk about any research that has been done on it.
yeah, yeah. So there's lots of research from Dr. Van Kolp, The Body Keeps Score, from Peter
Mm-hmm.
Levine,
Yeah.
to there's like a whole there's a Gaia channel. They have tons of research with somatics and like the body. And so, diving into somatics also includes like frequency. So understanding frequency, like everything in our world has a frequency that we are held at, and our emotions come with a frequency. So learning about frequency is part of somatics, learning about energetics, because our nervous system is energy, right? So looking at somebody that has bipolar, it's not so much a detrimental problem. It's actually a gift to have these moments where you can get shit done. And then there's these moments of rest. So looking at it from a different perspective, a bodily perspective, rather than a societal, there's something wrong with you perspective. And embracing that you have these gifts. I have a friend I work with in Modern Nurse Fest, our team, and she calls it her bipolar business. Like she's
I
like,
love
I will bust shit out for like 3 days, like nonstop, and she does, and then she takes like a few days off, and I'm like, and we just normalize that because that's just how she works, and then we normalize how I work, right? So we if we learn just how to complement each other, like that's what somatics is. It's complementing the human nervous system with other people's nervous systems so we can like live in harmony. Because really there's ultimately nothing wrong with anybody. We create these problems. And if you keep talking about those problems, they're just going to get worse. And that's why we go to the doctor every couple months so we can talk about our problems and how bad it is, because that's how the cycle continues. So if you keep talking about how good your life is, then your life's just going to get better. And that's ultimately what Somatics is. It's just like focusing on the joy, but also honoring like that you have a beautiful array of emotions. And you have the choice to pick whatever emotion you want to have at any moment of the given day. So
Beautiful.
yeah.
Can you?
How about the research? Yeah, I was going to
Well,
say.
I was going to say, how about some of your experience, like some case, like a case study or two, some wins that you've had, either you're personally or that you've observed in people that you've worked with.
Yeah, so a lot of work with teenagers that I've done ultimately have either subdued the suicidal ideations or thoughts that they're having, and either have gotten rid of them completely. Or when they do have them, they're like, oh, I'm just overwhelmed right now. Like, so they kind of scoff it off as being a thought rather than a detrimental circumstance. So that would be an ultimate win, especially with the teenager population. The
Totally.
next population, I mean, it's good for everybody. I've worked with, I think, like 80 people that want to become pregnant, and worked with them, and then like 72 have become pregnant without IVF, with diving into like sexual trauma, trauma of the hip pelvis area, um, diving into like chakra, energy, balance, right? So, opening up the hips and, you know, the sexual act, not making it so much of a stressful thing, because your body is going to reject rather than accept. So, you know, that has been ultimately seeing people get pregnant from just doing somatic work and like mindset work, envisioning like them being pregnant. So that's been pretty cool. I've had people with blood pressure no longer be diagnosed with high blood pressure. They've been able to come off medication just by visioning themselves like getting into a calmer state, envisioning their heart like glowing, instead of like this angry state. Um, let's see what else. We've had people like migraines go away. People either leave toxic relationships or toxic jobs, find joy, find new relationships. So there's like a whole cluster of results, you know, not just that I've had, but, you know, documented in tons of books from other light workers or whatever you want to call it. So
yeah. And just to reiterate or reinforce, it's not woo magic. I mean, it's because a lot of people, we do a lot of podcasts like this, and I like to reinforce that there is no mind body connection or mind body spirit connection. It's all one thing. Saying things are connected means that they're separate and there's a bridge. Yeah. And what you do, whether it's a visualization, whether you believe in chakras or not, I mean, there's a gland associated with every energy center. There's clusters of blood. So we have a physical and a energetic manifestation in the same areas. So you can just point to the pineal gland and the thyroid and, you know, the pancreas, what is it? Spleen. I think the spleen is one of them. Anyway, obviously the root and Wendy, help me out. It's what is the
part?
Yeah, but I've just overcooked this bird. There's a gland associated with every chakra. Period.
Glands and organs.
Glands and organs. Yeah. So, but everything that you're talking about, the somatic work, mitigates the stress response, the chronic, I mean, our stress response save our ass. There's a point to it. That's why we're still here as a species. But the innocent overusage of it because of what's going on in our head and our buying into what's going on in the head revs the engine to a point where it's not supposed to rev, and it causes downstream oxidative stress, inflammation that can cause all of those things. It can keep you from getting pregnant. It can downstream if you're in a stress state all the time. Your pregnenolone, which is the master hormone that makes all your stress hormones and your sex hormones. I know I'm saying that wrong, but it's the right letters, but I think I'm putting the stress on the wrong syllable. Pregnenolone, whatever. It's the master hormone that all of your stress and sex hormones come from. So if you're prioritizing pregnenolone for cortisol, which is your stress hormone, because you're constantly up here, well, there's not going to be enough distribution to have a balanced sex hormones, your estrogen, your estradiols, all your different ones, your progesterone that you need to maintain a pregnancy. So everything you're saying makes perfect scientific sense. And I love that I love to say it's the 10,000 keys that all open the same door. So whether it's cold plunge therapy, whether it's somatics, whether it's whatever, it's all mitigating the stress response. And the most important thing I think that you've talked about is just becoming the witness. I don't know why. That's just my personal, I've seen that power of witnessing yourself, even if you're repeating the same behavior that you want to change, but you're watching it do it. The next time it's going to change, or the next time, or the next time, but it mitigates the stress response, even if you're repeating the behavior and watching it. It's just so magical. It's real magic. It really
Yeah.
is. And I just love, we're going to attach some of the research that you've mentioned, and we'll find, who was the author? The Body Keeps Score. We'll put that in one of our sources, Wendy, because there's
Bruce Lipton. I mean, this is
Bruce
genetics,
Lipton.
This
so
is
many.
Dispenza's work.
Joe Dispenza.
This is
good.
all of that. There's actually should be oodles of research on all of this.
Yeah.
And I'm so excited that you're creating your own branch. It's like what Ed did with pranayama, Wendy, but it's like, this is for nurses. And I love what you're doing to help individual nurses in the nursing profession, and you're pioneering like a whole new thing on your own. I think it's wonderful. If people are more interested in somatic nursing, the mother of somatic nursing, how do they get a hold of you? What's the best way to read more about your work and what they can either benefit from or get involved in?
Yeah. You can find me at the School of Modern Nursing.com.
Which I love.
We have modernnurse.org. We have that coming up this year, and we'll be in like 4 different states in 2026. And that's
talk about Modern Nurse Fest.
What is that?
Yeah. So Modern Nurse Fest. I had my first one online in October. That came to me in meditation. I was like, why don't we have a festival like celebrating nurses and everything that nurses do, rather than just like these silos of like the surgeon nurses, the mental health nurses, right? Like, let's just get all the nurses together. And so in October online, we had 300 nurses from around the world come together, and we talked about like legal nursing, IV hydration, like all these out of the box nurse things. And we have one in Anchorage coming up September 25th and 26th. We'll be in Anchorage, Alaska for 2 days celebrating nurses. We'll also have a round table that we're going to have local and state officials and also the news there, talking about the state of healthcare in each state that we go to. And then 2026, we have Texas, California, Florida, and Boston, Massachusetts. So we'll be hitting all those states with Modern Nurse Fest, and really, really stoked about that. So
do nurses get nursing CEs for attending them?
They do, yeah. Every workshop, every speaker that we have, they'll be getting CEs for those workshops that they attend. Yeah,
awesome.
Yeah,
that's
so it's exciting.
Do you have that provider worked out?
Yeah.
To finish this appropriately, thank you so much, Emily, for your time, for your pioneering spirit, for all you're doing. I love that you're, as we like to say, blowing up the box that the rest of the world is still trying to think outside of.
Yes. I love blowing shit up.
Blowing shit up.
You're doing amazing work, and I love it. And I'm so glad I got to see that. And I'm so thankful that you came on today to meet with us and talk about it, because it's such powerful information, powerful conversation, and it's so necessary. And the time is here, right? The time is here for all this change. It's become so much more accessible, relatable, and I feel like more and more nurses are searching for it. Karen and I keep saying, we're doing so many podcasts that have these running themes that it's like, oh yeah, it's here. And so
it's
many
undercover consciousness.
Yes.
Well, except not so undercover when you just say it out loud like that. Well, we will continue to buzz from this conversation long after you get off and we talk about you behind your back, because that's what we always do after a podcast.
I appreciate it.
We appreciate you. Thanks so much, Emily. We will be in touch for I'm sure part 2. And anytime you just want to casually talk to me about microdosing, I'm up for that too.
Yeah, right on. Yeah. Anytime. I love it. Oh my God, you guys rock. Anytime. Yeah. Anytime you want to hang out, you guys are a hoot. So thanks for bringing joy into my day. I appreciate it.
Likewise. Renegades.